Good morning, everybody. My name is Cristobal Jr., Student Physical Therapist Assistant. Today, we're going to go ahead and discuss how we set up our ultrasound machine. First, what we want to do is go ahead and plug it in. Once you plug it in, we can go ahead and turn on this back button right here. It's a nice switch. Just flick that on, and our screen will go ahead and come on. Now, I'll go ahead and set you guys up so you can see the screen for what I see. So the screen just switched how it looked. Let me go ahead and position you guys for you to be able to see the screen right there. So we can see different options going on over here. We have electrotherapy, ultrasound, a combination of the two, and then switching, editing channels, patient card, selecting channels. Obviously, we're just going to go ahead and look at the ultrasound option. So we go ahead and click the buttons on the side for wherever we're trying to correlate with, because there's arrows that point to the correlation on the screen. So obviously it's correlated right here. That arrow is pointing to ultrasound. I'm going to click this button. Now we're looking at a bunch of information that just loaded up. We got our applicator size, which is our transducer head, how big it is in the circumference or diameter. Sorry about that. Frequency, we got right now 1 megahertz. Duty cycle at 100%, meaning it's going to go ahead and do thermal effects. Our display for how much watt per centimeter square we're going ahead display, and our treatment time. This is how we edit all those parameters so we can go ahead and have different modalities for therapeutic treatment. So head warming, I'm going to go from left to right. Head warming is in case we don't want this head to get warm right away. It's going to go slowly and gradually build up. So maybe it's good for patient tolerance whenever they got to build up that patient tolerance, and because they can't go right away to complete heat. So head warming is a nice option. Frequency, we got 1 megahertz, and if I tap this button, it goes ahead and switches to 3.3 megahertz. So the difference between 1 megahertz and 3.3 megahertz is 1 megahertz is going to go ahead and affect deep tissues. So this is going to be 2.5 centimeters deep into the body. So maybe we want to work in the ligaments of the biceps that's underneath superficial muscles like the deltoid, or we're going for muscles deep to the quads or gastrocnemius. We can go ahead and change this to 1 megahertz. So then when the 1 megahertz goes ahead and gets those deep muscles or deep tendons. Now if I switch to 3.3 megahertz, or really just 3 megahertz, this is going to go ahead and hit superficial muscles. So obviously we got hand muscles and bones, ligaments, tendons. This is for more superficial treatment. Maybe there's a superficial muscle, just the biceps itself, the deltoid itself, or the quads, the superficial muscle of the quads. We're going to go ahead and be at 3.3 megahertz because this is going to be getting at the depth of 1.5 centimeters for treatment within the body. Duty cycle, I'm going to touch more on this later with what thermal effects and non-thermal effects, but pretty much simplified right now is 100% means it's going to be thermal, where it's generating heat, and duty cycle is where it is pulsating the heat. So it is technically non-thermal. 10%, 20% means it's on for 1 second and then 4 seconds off. 1 to 4 ratio. At 50, when I'm at 50%, it actually is off one part and then on one part. It's still pulsating. It's on, off, on, off. 100% is completely on, always running. Display, so we can see it right here. This display changes this parameter right here, where it just changes what are we seeing for watts. Typically, we're going to be working with watts per centimeter squared, and this can be changed by this dial right here. So obviously turning it to the right changes the watts per centimeter squared, and dialing it down turns it off. And then lastly is treatment time. Right here with treatment time, press the treatment time arrow, it loads a new screen, and then we can go ahead and raise the time that we give treatment or lower the time. Typically, we're going to be at 8 minutes. With 8 minutes, that's going to give us our 1 minute of treatment time. In our book for acute inflammation care, which I'm going to touch on in a little bit, we would go 10 to 20 minutes, it says. Don't push past 20 minutes because obviously it's still, well, it's technically not heat with acute care, but we're just not going to push that 20 minutes because in the book it says that best 10 to 20 minutes is an effective time for the modality with acute treatment. But at minimum, we're going to go ahead and go with 8 minutes so we can go ahead and get our 1 unit for billing purposes. Now, to touch on about the information about 100%, 20%, and 50%, that is talking about thermal and non-thermal effects. Right now it's at 100%. This is at the thermal effects where we're going to go ahead and be providing heat all the time. We don't want to be providing heat to acute injuries. So obviously when we switch to 20, 50% and it's on off, then we can. This is going to go ahead, this 100% is going to go ahead and give that heat constantly through this head, and we're going to be moving that head around on the patient to always provide heat, obviously with the gel. But now if I adjust it to 20%, this is going to be on one part and then off for 4 parts time. So it's going to be on, then off, 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 on, off, 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 off. It's going to cycle. This is for acute injuries. If we're going to deal with acute injuries, we're seeing signs of pain, edema, heat, arrhythmia, and loss of function. That's our 5 acute signs of cardinal. That's our 5 cardinal signs of inflammation from possibly an acute injury. That's where we're going to go ahead and be at the duty cycle of 20 or 50, anything less than 100. If we're dealing with 100% for a duty cycle, that's going to be our chronic injuries. Long term, they're seeing pain. However, we're not seeing the rest of those cardinal signs. Pain can still be accompanied, but the other 4, we're not trying to see it. If we see it, it's more than likely an acute injury, but we need to get confirmation if it is acute injury or not. But simply put, 100% chronic injuries, anything less than 100, like 10, 20, 50, acute injuries. And then once again, this is our adjustment. With our adjustment, we got 1 watt per centimeter squared, and then it's going to be less than that or more than that depending on how much intensity we want to put through the transducer head. And then obviously, like I said, here's our transducer. We always want to make sure that this is plugged in. We can always have different transducer sizes. Maybe it's going to be less than 5 centimeters. Maybe it's going to be more than 5 centimeters. Depending on the size of our head, we want to work 2 to 3 times of a big radius. So we're going to work no more than 15 centimeters of a treatment area. And then to the side, we got our gel right here that we're going to go ahead and apply on that transducer head. Obviously, we take off the yellow cap and then apply that gel, rub it on the patient, and then before we ever press start, rub it on the patient, keep the head with the gel, keep going, do the circular motions, and then press start. We never, never, never want to leave this on the patient sitting still like that. That's going to burn them, that's going to injure them. We don't want any of that. Keep the head moving. And then obviously, cap comes off. You just pull it off, comes off, put the gel, and then once we're done, wipe off the gel, clean it up, and then put that cap back on. So that's the basics of ultrasound, of how we're going to go ahead and use that, set it up for any patient care routines that we got to do for chronic injuries or acute injuries. Thank you for watching.